guys, Dr. Greg. In this video, I'm going to go over how to use a nebulizer. Now, the first question is, why do we use a nebulizer? Your lungs are one of the key organs in your body for detoxification. They're actually a part of your drainage funnel. And if you've ever been exposed to things like molds or environmental toxins or fumes, like for example, I grew up around the coal mining industry, and I would say at least 25% of my class had asthma. So the reality is we've all been exposed. The question is, how bad have we been exposed? So when we nebulize, many of you have probably heard of nebulizers before, but we nebulize a very specific product that increases lung function and also can help rid us of some of those toxins that are in our lung tissue. I have actually used this product now for over 7 years with amazing clinical success. What I need to tell you is this stuff is powerful and it can be a huge asset for you on your health journey. So let's walk through the journey here. So the first thing is you need an actual nebulizer, and many of you may already have nebulizers from maybe yourself or your kids. Nebulizers are cheap. This one I think was under $60 on Amazon. We have links for this. The second thing that we need is distilled water. Please do not use tap water, as tap water has lots of chemicals in it, and we don't want to nebulize the nasty chemicals from the tap water. Lastly, we nebulize a product called HydrOxygen. And this is the product that I talked about that is profoundly impactful when it comes to the health of your lungs. So let's set this up. So you have the long tubing that comes with your nebulizer. The first part of that hooks into the unit itself. The second part, if you got this particular nebulizer, there's a spot on the bottom of this canister. And then many nebulizers come with multiple face masks or shields. I like the one that can go both over your mouth and your nose, and I'll explain why in a little bit. So in this case, this one friction fits right on there and looks just like that. The next thing is water and hydroxygen. So on this particular model, there's a little way that we can slide open the top of this device. So you can see that it's open right there. So on this one, the top level is 8 milliliters. So go ahead, and by the way, 8 milliliters is not much. Go ahead and pour 8 milliliters in there. And then to start, you're going to use 2 drops of hydroxygen, and you will work your way up to about 10 drops of hydroxygen. So for today's example, I'm going to put just 2 in there. And by the way, 2 drops, not 2 droppers, okay? 2 drops. Now the unit is set up and we're about ready to roll. I'm going to explain how this works. So the goal is to get this product into your lung tissue. And when we breathe, most of us breathe very shallowly. The goal of nebulizing is to fill up as much of your lung tissue as you possibly can. The other way is there's a couple routes that air can get to your lungs. One is through an oral breath or through your mouth, and the second way is through a nasal breath or through your nose. So we actually utilize both options with the nebulizer. So I actually want you to go back and forth between a mouth breath, and the next one you'll actually keep your mouth shut and you'll do a nasal breath. Why we do a nasal breath is we want the nebulized solution to actually go through your sinuses, because you would be surprised what gets to hang out in your sinuses. So the other thing is the breath itself. When you take a breath in a nebulizer, I want it to be a very full breath, much like this. As much as you can possibly take in, and hold it for a little bit, and then let it all the way out. So let's fire up this little guy, and you'll immediately see that a steam or a vapor comes out of the machine itself. So I'm going to go in, I'm going to take a big oral breath. And then let it out. And then I'm going to keep my mouth closed and do a big nasal breath. And then I go back to an oral breath and a nasal breath. Ideally, we want about 10 breaths through your mouth and about 10 breaths through your nose. Now, what you noticed is in between breaths, this thing just kept running. If you want to, you can turn it on and turn it off between breaths, though what you may also have are other people in your house that can benefit from this. So if that's the case, I would totally pass the nebulizer around and let other people benefit from utilizing the oxygen into the lung tissue. Lastly, some people will say that this oxygen really increases their energy. And if that's you, A, that's great, but B, make sure that you don't do it too late in the day. So this might be something you do first thing in the morning. We also know that there's times where you're really going to need this. So for example, let's say that you were in a toxic environment, or you know that you were around some mold, or you're going to be someplace that you're going to get hit with this stuff. Bring these things with. These units are small enough that you can travel with them. And what you'll find, like hundreds of my patients, is this is absolutely one of their favorite tips and tricks for lung health.